Do you sometimes leave a doctor's appointment feeling like your concerns weren't fully heard? Or worse, like you didn't even get a chance to ask the right questions? You're not alone, and today we're diving into a really important topic: how to advocate for yourself in medical settings, whether it's a hospital admission, a clinical appointment, or managing ongoing treatment, and you're trying to navigate your way around the treatment or care provided. I'll share practical steps that empower you to speak up, get answers, and feel confident in your healthcare journey. Here's the truth. Healthcare can feel overwhelming, and this is not even made easy by the complex nature of medical language, how appointments are often rushed, and it's easy to feel intimidated in front of doctors or nurses. But self-advocacy isn't about being difficult or impolite. It's about ensuring you get safe, effective, and respectful care that you deserve. Advocating for yourself can mean the difference between catching a diagnosis early, getting the right treatment, or avoiding unnecessary procedures. And here's the best part. You don't need to be an expert to advocate. I've learned over time from practice that you just need the right tools and confidence. That's exactly what I'll be covering today. Step 1. Prepare before you go for any appointment. Preparation is everything. Before your appointment, write down your symptoms, concerns, and questions. If possible, keep a symptom diary about an issue that is ongoing, the date of onset, what makes it worse or better, and how it impacts your daily life. For example, instead of saying, "I've been tired," which sounds vague, right? You might say, "For the past 3 weeks, I've felt extreme fatigue, sleeping 8 hours, but still struggling to function at work." You see, that level of precision and detail helps your physician see the bigger picture about your problem. Step 2, don't go alone if you don't have to. Bring support. Having a trusted friend or family member present can help you feel more confident. They can help you take notes, remind you of questions, and just back you up if you feel dismissed. You can think of them as your healthcare ally. I see this a lot working as a bedside nurse, where relatives are able to do more than just visit. They retain more information about their loved one's care, and even ask for clarification when the patient is in doubt about their treatment plan. The third tip I would say would be to ask questions. Just ask questions. If you don't understand something, it's your right to get clarity. You can use phrases like, "Can you please explain that in simpler terms? What are the risks and benefits of this treatment? Are there alternative options?" You see, doctors sometimes forget that not everyone speaks medical jargon. By asking, you make sure you live with understanding, not confusion. The next tip is using I statements to describe your experience. For example, instead of "You didn't explain that well," you could try, "I'm still confused. Could you explain it again?" Or instead of saying, "You're not listening," how about you try, "I feel like my concerns aren't being fully addressed." You can see that this shifts the narrative from a point where it seems as though you're blaming your provider to one about you seeking clarity. This keeps communication respectful while making sure your perspective is heard. Number 5, remember, you have rights as a patient. You have the right to ask for a second opinion, to decline a procedure, or to request more time to make a decision. In the UK, for example, patients have the right to be involved in all decisions about their care under the NHS Constitution. So wherever you are, check your local patient rights. Knowledge is power. Healthcare appointments can feel like information overload. So tip number 6 would be to take notes, or if possible, during your visit, ask if you can record the conversation on your phone, but just seek permission first. And that way you can go back and review the information later at your own pace. And this way you could even catch something you didn't notice whilst present at the appointment. Finally, I would say trust yourself. Trust your gut instinct. If something doesn't feel right, whether it's a diagnosis, a rushed appointment, or a treatment plan that just for some reason doesn't sit well with you, speak up. No one else knows your body better than yourself. Advocacy doesn't mean disrespect. It means being persistent until you get the care that you deserve. So, to recap, you have to prepare ahead, bring support, ask questions, use I statements, know your rights, take notes, and trust your instincts. These steps can transform your healthcare experience from feeling powerless to feeling in control. And remember, advocating for yourself isn't selfish. It's actually self-care. And the more you do it, the easier it becomes, and you get better at it. So now we've talked about that. What happens when you do all of this, but your doctor still isn't listening? That's exactly what we're tackling in the next video. I will share strategies for those moments when you feel dismissed, unheard, or brushed off in medical settings. If you found this video helpful, give it a like, share it with someone who might need this advice. Don't forget to subscribe for more content on navigating healthcare and protecting your well-being. Thanks for watching, and take care of yourself, because your voice matters.